world is in a new and dangerous phase. We have a shared duty to do everything we can to prevent, detect and respond to transmission of COVID-19.
Particularly now at the time of the COVID-19 epidemic.
The outbreak of COVID-19 pandemic has had a devastating impact on human life so far. We stand now, over a year since the day we realized life as we knew it was fundamentally altered from how it had been a month, a week, or even a day earlier. On 30 January 2020, the World Health Organization declared COVID-19 a public health emergency of international concern. Iran reported the first cases and fatalities in the country on February 19, 2020. After a year of suffering and unimaginable loss, there is now a renewed sense of optimism in the fight against COVID-19. This is the story of ICERP, the Iran COVID-19 Emergency Response Project. In early 2020, the Ministry of Health and Medical Education of the Islamic Republic of Iran began implementing a set of strategies to control the epidemic in Iran. One of such measures was utilizing the support of international organizations to further strengthen the country's health and treatment system. ICERP was officially launched on 16 June 2020 as a collaboration between the World Health Organization and the Ministry of Health and Medical Education of the Islamic Republic of Iran, facilitated through a $50 million loan by the World Bank. The project has since procured and delivered 451 essential and life-saving medical and diagnostic equipment to 182 public hospitals and laboratories across 31 provinces of Iran, caring for COVID-19 patients, including CT scanners, portable ultrasound devices, digital X-ray machines, ECMO devices, video laryngoscopes, CRRT machines, biplane angiography machines, liquid handling devices, nucleic acid extraction machines, along with the consumables such as PCR testing kits. The recipient facilities were nominated by the Health Ministry to receive the most needed medical and diagnostic devices, which were later purchased and procured through a competitive global tender from countries around the world via air, water, or land. All selected health facilities were inspected for being socially and environmentally safe in the initial on-site assessments prior to the arrival of the equipment. Toward the end of the project, they were revisited by the third-party verification agent to ensure all devices are operational at the initially selected facility. The project was officially inaugurated on 18 February 2021 at the Ministry of Health and Medical Education of Iran in the presence of high-ranking officials from the government and WHO regional and country offices, as well as representatives from universities of medical sciences. As ICERP developed swiftly from procurement to delivery, over a span of 12 months, the life-saving equipment was fast reaching those most in need in the near and far healthcare facilities across the country. And whenever there was no way, we built one. In this collaborative effort, the World Health Organization has stood by the national health system to ensure everyone across the country is well equipped to get through this pandemic and potential emergencies to come.
ICERP, the Iran COVID-19 Emergency Response Project.